episode on HealthLink TV show. Today's topic for discussion is typhoid fever. Our guest, who is a public health officer, will educate the people of Willie on some causes and prevention of typhoid fever. Welcome to HealthLink TV show. This show is proudly sponsored by Serene Insurance, Livestrong campaign by Nestle Ghana, Royal Aroma Fortified Rice, New Fritor Sunflower Oil, and Vital 20 Immune Booster. Let's go for a breather. When we come back, we'll start our discussion for today. Ago, me de queen don't know me. Edo, yo, me de queen Condestella AJ. I'm a registered midwife at University of Ghana Medical Center and the host of HealthLink TV show. This afternoon, we are here purposely for us to discuss typhoid fever. And I'll be doing this with a PA as well as a public health officer from Fodome Helu. He will educate us on typhoid fever, how best we can prevent it in this community. So I don't want to talk too much. I want to use this opportunity to welcome Mr. Victor Lumo from Fodome Chip Compound to educate us on how best we can prevent typhoid fever. Pia, you are welcome.
Thank you, Mr. Stella.
All right.
I'm grateful for this opportunity to discuss with you as well on typhoid fever and the community as well.
Great.
Yes.
Don't mention.
Okay.
So let's go straight to the point. What is typhoid fever? I've been hearing a lot. Mania fever, I've gotten fever, I have fever, I'm having this. What at all is typhoid fever?
Okay. Typhoid fever is an infection from a living organism that is called Salmonella typhi. And usually this is spread through the lymphatic system to other parts of the body. Please
kindly break it down a little for us, the lymphatic system, and kindly break it down for us to understand.
Okay. These are tissues connecting various parts of the body.
Okay.
And usually when there are infections, they are triggered to be able to respond to, and they carry messages to other parts of the body.
So how can someone get this infection? What are some of the sources of the typhoid infections?
Okay. Typhoid infection can be gotten through the feces of an asymptomatic patient, or through the urine of a person with the active disease.
Okay, so let me take you back a little. What's the meaning of asymptomatic patient?
Okay, which means that asymptomatic means that the person had this organism, Salmonella typhi, in his body, through the mouth to the body. But the person is not showing any signs of it. Or the person is not having any feeling in the body to show that I'm experiencing typhoid fever. So that is from the feces of somebody who is asymptomatic. Then we can also get it from the urine of somebody with the active disease. What that means is that the person is having the organism in the body, and at that time can also be able to show signs of the disease. Which means that the person will be experiencing things that will make or could probably send a person to the hospital to present with this disease.
Okay.
Yes, and when we move further, we'll talk about the signs and symptoms of it.
Okay. So can I get typhoid fever if I eat with such person?
You could get typhoid fever by eating with such a person. The means is that if the person you are eating with have not washed their hand very well before coming to eat with you, you can also get it through that means.
All right.
Then to add on to it, in communities where there is poor sanitation, where people don't take good care of the environment, then they can also transmit typhoid infection through water bodies as well. Which means that some people who are having the infection, who swim, urinate or defecate around our water bodies, can send this organism into the water bodies. So when you go and fetch that water to your home to cook, then you could also get that typhoid. The last means by which we could get typhoid fever is through people who handle our foods or food sellers. They can also be a means by which we could transmit typhoid.
Okay. All right. So how does this infection enter our body?
Okay. Typhoid infection enters our body through the, gastrointestinal system, which starts from the mouth. So basically, for typhoid to enter into your body, it means that you should have come into contact with food or water, and we take these things through the mouth. Then it enters the stomach, gets into the bloodstream.
Doc, in case I take in contaminated food, how long will it take for me to show signs and symptoms of typhoid fever?
Usually that will take between the days of 3 to 25 days.
Okay.
So when you come into contact with such food today, to take within a period of 3 to 25 days, then that person can begin to show signs of it or can be complaining about typhoid fever.
So why is that some people is 3 days and others 25 days?
Usually that is we call it incubation period of the organism.
Okay.
During that 3 to 25 days, the organism will enter, spread, mature to other parts. Then after that, you can be able to experience the symptoms of typhoid fever.
Right.
Howbeit, that also depends on the immune system of the person.
Okay, so meaning someone with low immune system or low immunity, the person will show the signs and symptoms within the first 3 days or what? Is that what you mean?
What that means is that somebody who has a low immune system will not necessarily hit the 25 days.
Okay.
Between the period of 3, 10, 12 days, that person can also be able to manifest symptoms of typhoid fever.
All right, doc. So in case I'm having typhoid fever, what are some of the signs and symptoms, or how will I know that I have typhoid fever?
Good. When you have typhoid fever, you will begin to see what we call or experience some symptoms in your body.
Okay.
Symptoms basically means that you, the patient, or you, the one experiencing the typhoid, will complain about these things.
Okay.
One of them is that you experience chills or feeling cold. The second one is that you could also have temperature, having fever. Another one is that there's a presence of anorexia, which means that you don't also feel for food.
Okay.
Some people also constipate during the period of typhoid fever. Then there's general malaise, or you begin to feel tired on the slightest physical activities. Then, or also joint pains. Then people usually will complain about that.
Doc, I want us to talk about the difference between typhoid fever and malaria. Viewers, you are watching HealthLink TV show. This show is proudly sponsored by Serene Insurance, Live Strong campaign by Nestle Ghana, Royal Aroma Fortified Rice, New Frital Sunflower Oil, and Vical 20 Immune Booster. Let's go for a quick break. When we come back, we'll continue our discussion of prevention of typhoid fever in rural areas. Welcome back. Before we went on break, we were discussing typhoid fever, the causes as well as the signs and symptoms. Doc, let's move to the difference between typhoid fever and malaria. In case I'm showing symptoms of a disease, how will I know whether I have typhoid fever or malaria?
Okay, that's a very good question. Typhoid fever presents almost in the same way as malaria will present itself.
Okay.
Because in typhoid, you experience the fever, chills, headache, joint pains. Malaria also gives you the same fever, chills, headache, joint pains, malaise. But the only thing is that usually typhoid have a fever that is usually irreducible within some space of time when you start manifesting them. The fever keeps rising, rising, and rising. And it presents almost the same thing way as malaria. It also gives you more of joint pains, which in some people you don't experience this malaria. Yeah, that is it. But the difference basically is the test that you conduct in typhoid and also in malaria. Where malaria you do RDT or blood film for malaria parasites to be able to tell. Then in typhoid you'd have to do the typhoid test to be able to tell the difference between them.
All right, so in case I'm having fever or I'm having high temperature, I can't just go and buy any medication to treat it or malaria medication to treat it.
Yes.
I need to go in for lab investigations before I can get medication to treat myself.
Yeah.
Now let's go to complications. Like in case I'm having typhoid fever, now I don't go to the hospital. What can happen to me?
When you have typhoid fever and you don't go to the hospital, which means that the disease is going to progress to a place where you experience the complications of it. One of the complications is that people usually bleed in the stomach.
Okay.
Some of them also have what we call abdominal perforations, which means that the organism can cause sore on your intestines. And usually those are very severe forms of typhoid as well.
Doc, if I come to a facility, how will you diagnose me that I have typhoid fever, or how will you know? What will you do on me in order to detect that I have typhoid fever?
Okay. So usually, as I said earlier on, we have to do a lab test for you.
Okay.
To be able to confirm whether you have typhoid or if it is not typhoid, malaria.
Okay.
So that's why I said the organism usually trigger antibody response. And when we do the labs, we can be able to pick this and confirm that it's typhoid.
I did a research and it shows that typhoid fever is part of the top 20 causes of outpatient morbidity or deaths in Ghana. Doc, so is it treatable at all?
Okay. That's a very good question. Typhoid is treatable.
Okay.
When you come to the clinic or the hospital and then they do your lab investigation and they realize it's typhoid, there are drugs they can give you to clear the organisms out of your body.
Okay.
Usually when people visit the facility, they will say that typhoid have been worrying them for the past 10 years, 5 years. It is treatable.
Wow.
It does not stay for such duration.
Okay.
Those are some of the misconceptions that people present with. So typhoid is treatable.
Now that you've mentioned misconceptions, what are some of the misconceptions surrounding typhoid in this community and other communities around?
Yeah. Some of the misconceptions are that people feel that typhoid can live with them for years. So some of them will tell you that, oh, I've been experiencing typhoid for the past 10 years, 5 years. That is the only thing that is worrying me. When you have typhoid and you visit the hospital and they give you drugs, you take it accordingly, then the organism will be cleared out of your system. The only way it can stay longer with you is that when they give you the drugs and you don't take it well.
Okay.
That is the only way the organisms can be there. Now, there are sometimes typhoid can also reoccur.
Okay.
So when you take your drugs and you still expose yourself to the things that are there, like coming into contact with contaminated food and water, then typhoid can reoccur even though it is treatable.
Okay.
So you could have it 2, 3 times or 4 times in a year.
Wow.
Depending on how you expose yourself to the living organism. As we mentioned earlier, when you come into contact with people who are carrying the disease but don't handle the food well, they are not washing their hands well. Somebody is selling, I've just urinated but I've not washed the hand, and I've come to serve you your food, can put the organism in the food for you.
All right, though. So how can we prevent typhoid fever in our various communities? This is the most important question of this whole discussion. I want you to throw more light on that and also give us some ways that we can prevent typhoid fever in our various communities. Yes.
Good. Yes, sure. So ways by which we can prevent typhoid are just the opposite of what I mentioned in the causes. We said that in a community where there is poor sanitation, people don't take good care of their surroundings, typhoid fever can come into their body. So one of the ways is that we keep our surroundings and environment clean.
Okay.
We also mentioned as part of the causes that people who handle our food, who do not wash their hands very well can also give us typhoid. So as a means of preventing typhoid in the community, people who are selling food should have a means of washing their hands before coming into contact with their food. Then also, we mentioned as part of the causes that when people come into contact with our food and water that are not well handled, they can also transfer it. Which means that if somebody comes to the facility and it is confirmed that, oh, this person has typhoid, it does not end over there by just giving the person drug and the person should go away. But there should also be follow-ups. Is this person taking the medications accordingly? What kind of work is this person doing? If the person is a food seller, then during the period where the person has been confirmed to be having typhoid, then the person should be excused from selling food or handling food to people in the community until the person comes for review and have been confirmed that the organism have been cleared from the system.
All right,
then the person can go on.
Since you've mentioned those people selling foods, some of us, we have lesser control over that. You wouldn't know whether this seller is having typhoid or not. And you mentioned incubation period of 3 to 25 days. Is there any protocol available for them to be running regular checkups or something in order to protect the people in the communities?
Yes. So one of the things we can do is that people who sell food to the community should not just come and say that I'm selling food and this is where I want to sell food and this is how I want to handle the food. Flies can also transmit what? Typhoid. When somebody who is having typhoid defecates here, a fly falls on it and comes in contact with your food, that person can transmit typhoid. So more often, people who sell food should have a medical exams where they declare the person fit to be able to sell on the roadside. And periodically, those people who sell food on the roadside should visit the hospital and have themselves checked before they can be able to sell food to us. That is a way to be able to protect the community. Then, our surroundings, we have to keep them clean. When we allow people to defecate anywhere in the community, flies that come into contact with this human feces go directly to come into contact with our food as well. So it is advisable that as a community-based work, there should be a way to have our toileting facilities well kept and we don't encourage people to be defecating around. Also for our water bodies, we need to make sure that people do not defecate around our water bodies. Because most communities, that is where people go to fetch their drinking water. So we should discourage people from defecating in the community and around our water bodies.
We've gotten to a different segment of the program. We want you to ask Doctor any question that you have concerning typhoid fever. He's over here, he'll give you answers to it. So Doc, let's stand in front while they ask their questions.
Typhoid lo nu pome globe ena doka fiche ngona me ne ngona nere atike yo minare ne nade doka fiche adra.
If it happens that way, it means that they have to surgically go into the abdomen before they can be able to correct these perforations. So that is why it is advisable that you report early to the facility.
Okay, my question is, the typhoid as a whole, is it an airborne disease? Is it a communicable disease? Is it a killer disease?
So as you have asked, well, if typhoid is an airborne disease, as I mentioned earlier, typhoid is not an airborne disease, but we can find it in our stool or urine or in contaminated food as well. So it is not an airborne disease. But typhoid can also kill people.
Okay. So please, I want to also ask you a question. Whoever will answer the question, I have a very nice package from one of our sponsors, Nestle Ghana. So my first question, I'll throw it to our mothers. Then the second one will go to our fathers. The first question is, how will you know that you have typhoid fever? tell me about 4 signs and symptoms that will let you know that you have typhoid fever.
Afi na nyabe typhoid le wonla na po symptoms do egba feverish avvo na no wo pepefo na no vo alamepete general body pain ple domeche na no do sesere.
She has
Amen.
mentioned 5.
5.
Yeah.
So we can give it to her.
Yes.
Okay. So because you've been able to answer this question, Nestle Ghana is giving you a very beautiful basket. This is an iron basket. Nestle Ghana is promoting the intake of iron. If you open this basket, we have red beans, white beans, bambara beans, agushi, we have kokrozi. So after preparing your rice and beans, after eating the food, you need to add an orange, either an orange, pineapple or mango. This contains vitamin C. It will help in the absorption of vitamin C. Then it will boost your immunity. That's the function of iron. So as a nursing mother, you need to have strong immunity to fight against a lot of infection. Also produce enough breast milk for the baby. So come for your package from Nestle Ghana. And not only that, they've added 1 box of Maggi to it. This Maggi contains iron. So when you're preparing your stew, kindly add 1 to it. Make your food very delicious and enjoy at home, okay?
No, what a picture.
The next question is to our fathers over here. How can you prevent typhoid fever in your community?
Egbala mi ajujo adudo afoji dedere mi afe echi ogbo mi apogbo be mi akolo mi abasi onwere ape awo mi abe ndudu mi apogbo mi abe chi o le jajere ape mi akodanu etola mi afe ndala wala ele wa ikoji wa dopo be edo melon wo ape wa jira na mi apena.
Nestle Ghana is giving you this package. This is the iron basket. You are a young man and you are working so hard. You need to build your immunity. So because of that, Nestle Ghana says, take this package. It contains red beans, white beans, bambara beans, agushi, brown rice, kokrozi, then Maggi. This Maggi also contains iron. So add it to your stew when you are cooking. After eating, you need to eat vitamin C. The vitamin C will help in the absorption of the iron. If you don't get orange, you can add pineapple or mango to it. So on the behalf of Nestle Ghana, I want to present this package to you. Thank you. Okay. So, Pierre, what's your last words to our audience before we leave?
My final word to our audience is that even as we have learned about the prevention of typhoid fever in a community, we encourage that we should all take all these preventive measures and adhere to them. And also, we also call on the chiefs and elders to be able to enforce that people who handle our food in a community are tested and declared free from typhoid before they sell food to us.
Akwe. So thank you so much for coming. Thank you so much for joining us. Viewers, thank you so much for watching HealthLink TV show. Join me next week for another interesting episode on HealthLink TV show. HealthLink, everything on health. Ever.